Bismillahirrahmanirrahim and Assalamu alaikum. I'm Professor Dr. Ijaz Ahmed Khan and I work at Health Services Academy as a professor. I teach their environmental and occupational health course and some other courses including epidemiology, research process, disaster management, emergency preparedness, and etc. So today we are going to talk about healthcare waste management, which is module 5 in your course of infection prevention and control. And in this module, and especially in this first session, we are going to cover a few skills which are very important, such as to identify the different types of waste, how many waste, what kind of waste are available in the hospital or clinical settings, and then to explain different types of waste which were identified and differentiate between the infectious waste and the general waste. So there are usually and normally there are two major kinds of waste which we define, which we segregate into general waste and the infectious waste. And this infectious waste is not much. It varies from 15 to 25%, and we take an average of around 20% of the waste generated by a healthcare facility. So the larger the healthcare facility, the more is the waste, and more part of it is the general waste, which you always see in the household level or at any workplace, what you find in cardboards and other things. So, but the infectious waste is something which is very dangerous, and if it is not properly segregated and taken care of, it can cause diseases. And most of them, they are the very dangerous infectious diseases such as HIV, AIDS, hepatitis B and C, typhoid, and many other infections which we see around. So let's define the healthcare waste. So healthcare waste is any waste material that is generated in the course of healthcare activities, including medical, dental, nursing, and laboratory activities. Healthcare waste can be generated in healthcare facilities as well as at the household level. So it is wherever the medical care is being provided. It can also include the field post or during the emergency situations or during the disaster situations, wherever the medical treatments are or the care is being provided, the medical waste is generated, and that needs to be taken care of in a very much proper way. So let's look at the importance of healthcare waste. So why it is important that we should be doing the healthcare waste management, because you see that it carries a lot of hazardous and environmental degrading factors with the improper management of healthcare waste. I talked about the infectious diseases like HIV, AIDS, like hepatitis, typhoid, and other diseases. So, but it can also have these toxic chemicals and the radioactive materials which are generated by chemotherapy of the patients, or by the taking the radiographs or doing the radiotherapy of the patients at the healthcare level. And ultimately, if it is not properly handled, it is going to damage the human life, and in general, all the living things around, they will be damaged by, or they will be inflicted upon with many diseases by the improper management of the healthcare waste. And secondly, healthcare waste management is also very much important, because hospitals have the primary duty of doing no harm. So if the hospital or a clinic or a healthcare post or healthcare facility, they are not doing the proper management of their healthcare waste which they generate. It's not coming from outside. It's something which is generated through the activities of a healthcare facility. Then it is going to, instead of controlling the disease, it is going to introduce the infectious agents into the environment, or the bugs into the environment, and those infectious agents are going back to the environment, and then you get more burden of the disease. So that is absolutely against the mandate of a healthcare facility or a hospital, which are mandated with treating the disease and preventing the infections. And finally, it is also important to look at the environment, how it affects the environment. So if a lot of healthcare waste is going into environment and untreated healthcare waste is going into environment, it's going to go and pollute the environment. Usually in low resource settings or where the laws are not properly implemented, it is seen that the healthcare waste is mixed with the general waste and it is taken untreated, taken to the landfill, where it is dumped and then it leaches along with the all the other chemicals present in the general waste into the groundwater and pollutes it. And of course the air pollution which it causes, the nuisance of smell that it causes, and another very important danger of improper healthcare waste and throwing out it without any treatment or without any proper prescribed process into this, sending it into the landfill is that it exposes the scavengers to various diseases. So especially in our settings, if you go around in Pakistan, where the healthcare waste management, the places where the healthcare waste management is not properly instituted, you will find scavengers, even small kids picking up these syringes and other things which are thrown just like that, and again that exposes them to the highest level of risk of acquiring infection. So there are several types of healthcare waste, and we talked about them one by one and then we explain them. So to start with, the first one is the infectious waste. So the infectious waste is the one which is contaminated with blood or other body fluids and is capable of transmitting infectious disease. Then we have the pathological waste, and these all go along the type of facilities from which the activities that the hospital do. So the hospitals, they do several activities. You see, when it's about the labs, or it's about the drying blood and using the syringes, or transfusion of blood, or doing the surgical operations. So that adds to the infectious waste. Pathological waste, it comes into where we see body tissues, or from the labs where the experiments are done, we find animal tissues. Within the hospitals, discarded placentas or body parts which are amputated or which are discarded. Sometimes they are found mixed with the general waste, which is absolutely against the not only the medical advice or healthcare waste management, but also if we look at the different social norms and cultural norms and the religious norms, it is not appropriate to do so. So that pathological waste is generated, and that also need to be properly managed and disposed of. Then we have the sharp waste. So sharp waste, it includes all the needles, syringes, scalpels, and other sharp objects that can puncture skin and transmit infections. Even in the labs, when any glass is broken. So if the glass bottle is broken, or a glass is broken, and the container, it contained some material, maybe it can be blood, can be agar material, or it can have the samples in it. And if a person who is working in the lab and he gets that breached into his skin, he gets any wound, then he might expose himself to that infection, which might be there in that glass or on that sharp object. And then it comes about the chemical waste. So that waste that contains hazardous materials such as disinfectants, certain pharmaceuticals and laboratory chemicals, and they may also contain different drugs which are the cytotoxic drugs. So those can also be there. For radioactive waste, all the medical imaging and healthcare appliances from whatever the waste is being generated by those activities it comes under the radioactive waste. And of course the general waste. The general waste, though it doesn't pose any significant risk, but it is a major bulk of any waste coming out of the hospital. Big hospital or small hospital. The bigger the hospital, the more the waste is. Most of the time it is food waste, packages, empty you can say empty Tetra Pak type of things of different juices and milk packages and other things. So let's look at the infectious waste. Now we go by them one by one. So infectious waste, which is also known as biomedical waste or biohazardous waste, there are different names given to it. The simplest one is infectious waste. That includes the material that is contaminated with potentially infectious agents such as bacteria, viruses, fungi, prions. And as we discussed, there can be a number of examples for them. Needles, syringes, animal blood or body fluids, human blood or body fluids, contaminated dressings, bandages, and gauze pieces. Laboratory specimens in the cultures, animal carcasses and the parts, those come from the experimental labs. Isolation waste from the patients with infectious disease from within the isolation wards, and we have gone through COVID. And COVID was one big kind of motivation for the hospitals to build up on their capacity, to build up on their capacity of healthcare waste, because a lot of sensitization was there about the use of PPEs, personal protective equipment, and disposing of the waste of the COVID patients. And then how to tackle with this infectious waste? The best way is this, that you segregate the infectious waste at the point of generation. That is very much important. If it is segregated at the point of bed, for instance, along the bedside where the patient is being given the medical care or having the blood drawn or giving the injections. So if a separate color-coded container is present and those are put into those and not mixed with the general waste, that segregation will help at the end to identify the infectious waste and take it to the proper way it should be treated and then disposed of, which we'll be discussing in the next sessions of this module. Explaining pathological waste. Pathological waste, as I told earlier, it includes human or animal tissues, organs, body parts, which are removed during surgery or autopsies. So, and those can be like limbs, organs, tissues, placental tissues, products of conception, fetuses, stillborn infants. Pathological waste can be of different type, and several surveys, and even myself, I did a survey perhaps around 15 years ago. That was a nationwide survey, and I found body parts and the blood bags thrown into the general waste, mixed with the general waste around big hospitals. So these things happen and they are seen. So now the things are much improved. Now they take a lot of care, but still it's very important to understand what are the pathological waste and how to manage them and how to treat them. So pathological waste should be properly identified, handled, and disposed of to prevent contamination, exposure of the infectious agents. So it is almost similar kind of thing, just like infectious waste. It can also infect, but because these are the body parts, they are called as the pathological waste. So let's look at the sharp waste. What are the sharp waste? So sharp waste, they include anything that can puncture or lacerate the skin. It's simple. So any object which is used in the care or treatment of a patient and it is available and it can pose harm to you by puncturing your skin, it is a sharp waste. So examples are needles, syringes, scalpels, lancet. So there are a number of the broken glassware, for instance, IV catheters and tubings, and dental wires and files. So all these material which have been used on patients, and they are not properly neutralized or sent and properly disinfected. So the sharp waste, they should be collected in puncture resistance containers, and you might have seen those yellow containers in the hospitals in which syringes are put in and all the sharps are put in. So whatever the container is available in your hospital or at the clinic or at the health facility or in the field, maybe it's a yellow colored drum or red colored drum, or it's a plastic container, but it should be at least puncture resistant, so that whatever the sharp is in it, it doesn't come out and harms the person who carries it. So chemical wastes, they include materials that are hazardous to human health and the environment, such as disinfectants which are used in the hospitals, and you must be aware of a number of disinfectants, chlorhexidine and bleach solutions, and there are a number of other, and depends upon on which hospital place you are using it, whether it is they are wards or they are the operation theaters or the dental procedure rooms. So the more the sterilization or the disinfection is required, the level of those chemicals they change. So and those can also come from the labs, and there are a number of other chemicals which are available after the treatments and care of the patients in the hospitals. So there are a number of disinfectants and sanitizers, and we have been using sanitizers during the COVID time as well. And now we are well aware of number of disinfectants and sanitizers. So there are a number of sanitizers and disinfectants which are used in the cleaning of the hospitals, the linens, the pathways, the corridors, and the floors of the operation theaters and labs as well. So all these chemicals, they go into the, if they are let untreated, go into the drain, they can cause harm. Then there are a lot of unused pharmaceuticals like injection vials and the tablets and leftover drips. So they are also available there. They constitute to the chemical waste. Then there are many reagents and chemicals which are used in the labs for different reactions to see for different kind of tests run. Then mercury and other heavy metals are also found, like for thermometers they have the mercury. There are other batteries, discarded batteries are there which have lead in them. X-ray and photographic chemicals are also the chemical waste, and chemical waste therefore need to be identified, segregated, treated and disposed of according to the local regulations. And for Pakistan, we have the Hospital Waste Management Rules 2005 and the guidelines which are developed under those rules. So they are very explicit, and they give the guideline how to deal with different kind of waste in the hospital. Then we have this radioactive waste. So radioactive waste includes materials that contain radioactive isotopes used in the medical imaging and other healthcare applications, and they can be classified as or can be included such as used for the medical imaging. And for medical imaging, they use technetium-99m and iodine-131, for instance, when this imaging is done for thyroid scan, or look at the condition of the thyroid if you try to find out any nodule in the thyroid. Then other procedures such as for cancer chemotherapy, for brachytherapy, and then we have these laboratory equipment and the waste. They can also contain the radioactive waste. So radioactive waste, they should be handled, stored and disposed of according to the local regulations and the rules. And they have usually the radioactive waste are placed or contained in separate facility where the background decay process is observed. And that is very much important, that how much background decay has been passed and when that radioactive waste has to be disposed of. And there are a number of ways to dispose that radioactive waste, and one of those is to give back it to the company from which you have bought. And same goes for the pharmaceutical waste as well, if you don't have the proper way of dealing with them in your facility. And last but not the least, we have the general waste, which makes the major bulk of this all waste, and it has all that food waste and organic material, paper, cardboard, plastics, and all those things. And even they might have those empty medication vials and IV bags if mixed into that general waste. And we have found by visiting the bedsides of patients in the major hospitals, and when we used to empty those baskets, which were supposed to have only general waste, we could find syringes or vials or IV bags in them. So segregation is the main portray of this, or main point. If it is segregated at the bedside, then the general waste will be separate from the infectious waste or the chemical or other waste or pharmaceutical waste, and it will be easily to handle, and it can be sent to the general landfill for the disposal. But it must not contain any kind of infectious, pathological, chemical or radiological waste in it. Right. Thank you very much.